Well, new numbers from the province's science table show that Ontario has been able to contain the fourth wave, but it says continuing some public health measures is necessary because the risk of transmission will increase during the winter.
And the latest modeling was released just hours before the Premier announced that capacity limits will be lifted in most settings this Monday, and that any remaining pandemic public health measures, including masking, will be lifted by the end of March. To discuss this, we're joined by Dr. Fahad Razak, an internist with St. Michael's Hospital and a member of the Ontario COVID-19 Science Advisory Table, Dr. Susie Hota, the infectious disease specialist at University Health Network, and Dr. Lawrence Lowe, Peel's medical officer of health. So, Dr. Razak, let's start with you. Of course, a lot of questions about, how what was announced today is going to fit into, the modeling projections that the Science Advisory Table had come out with today. So, you guys had said that, we are in a good position, and if we lift public health measures, that's where, we start to see some variables come into play. What are you thinking today as you hear that capacity limits are going to be lifted in a lot of sectors across this province?
Yeah, so what our modeling showed is that you can start the process of opening up some parts of society, things like public venues, gyms, restaurants, et cetera, as long as you maintain other appropriate public health measures, and importantly, the requirement for vaccinations, so vaccine certificates, masking, and again, focusing on things like ventilation and filtration. So I think actually this is quite a reasonable balance. And of course, with COVID, you have to remain humble. So if things start to rise, react quickly. But this is the right time for this kind of progressive reopening, and I think it's quite appropriate based on the modeling.
On that note, Dr. Lowe, as the medical officer of health for Peel Region, are you comfortable with this timeline, considering that you have the ability to extend some of this timeline as you see fit?
Well, I think the most important thing is to continue monitoring the trends. We are in a very different position with, in nearly 83% of our population in Peel double vaccinated. But it is the vaccinations and also the vigilance that is going to be absolutely essential. We know that children 5 to 11 still remain to be vaccinated. Certainly that school age population represents the most significant susceptible reservoir in our community. And so it's going to be vital for people to continue with the precautions, with the compliance with the certificates, and getting vaccinated if they haven't yet already, to make sure that we can make that roadmap become a reality.
But Dr. Lowe, would you say you support this timeline that the province has put out?
I think certainly it is a very gradual approach, and I think we very much welcome that. Certainly with the focus on venues that have certification requirements in place, those actually indicate our data that suggests that getting vaccinated is the best way to protect yourself against severe illness and death.
Okay, so let's talk about mandatory masking. Dr. Hota, there has been a lot of talk about how the masks have really helped us kind of keep a lid on COVID-19 transmission. By March, do you feel that there is a comfort level with how we're doing with the pandemic, the vaccination rate, especially with vaccines with young children, that, we can indeed take off our masks and have a maskless March?
This is probably one of the trickiest parts of this reopening plan, in my opinion. It's really hard to know what it's going to look like in March. And that's why I think it's really important to understand that there are stop points that can happen along the way. So as we proceed with this plan, we're always going to have to be watching what's happening with the case counts, with hospitalizations, with any new variants that come into the picture, so that we can understand if it's going to be okay for us to take the masks off. And my opinion is the mask should be one of the last things that we should be removing, because it does kind of provide that universal prevention across the board, on top of vaccination, on top of everything else.
And on the flip side, if cases start to increase, do you feel like it should be one of the first measures to be re-implemented along with physical distancing?
I do. And, for the most part, masking is well tolerated, and, it can provide, protection for the person who could be exposed. It's also source control, so it kind of acts on both fronts. So I do think that can be a very quick and easy thing to implement across the board. And hopefully people will be willing to actually do it again. And this is where it gets a bit challenging as we start and stop things all the time.
Dr. Hota, one more question for you about starting and stopping things all the time. Does it make sense to have this vaccine certificate mandate in effect if it's going to be something that the province rescinds in, as early as sometime in January?
Yeah, it does feel like we're just starting to talk about these vaccine certificates and get them going, and then we're already talking about when we would be stopping them. Again, I'd like to see that as gradual as possible and really informed by what's actually happening, what our progress is. So these are guidelines, and I think that while we're trying to lay it out so that there's some transparency as to what sequence is going to look like and what the timeline could be, I think we're going to have to tailor it according to what our progress looks like.
Dr. Razak, the Ontario Science Advisory Table had come out today with a letter to Premier Doug, earlier this week, I should say, with a letter to Premier Doug Ford, in favor of mandatory vaccinations in healthcare settings. Were you disappointed today that we didn't hear anything about that, either or what the government is going to do?
Not disappointed. I think the government should take its time to make the decision here. If you look at the way that our letter laid out an argument around requiring vaccines for healthcare workers, I think we think it's both essential for patient safety, but also for healthcare worker safety and for our stressed hospitals and the healthcare system in general to continue to work. So ensuring that people are vaccinated, anyone who works in a hospital is vaccinated, is the surest way to get us as safely through this next phase of the pandemic as possible. We really feel that the science supports that. I hope that our letter helps the Premier and the government make the right decision.
Dr. Lowe, do you feel like especially because William Osler and that health system, Brampton Civic, one of the hardest hit during all three waves of the pandemic, do you feel like mandatory vaccinations for healthcare providers is a sound policy for the province to put in place?
Well, I think ultimately it's a decision that has already been taken by many hospital systems, and certainly one that, the province should carefully look at. I know there's concerns around health human resources in hospital, but we also know that one thing that does also disrupt hospital operations significantly are exposures and outbreaks, in addition to the patient safety issues and professional safety issues that Dr. Razak has mentioned. And really, I think this overall reopening roadmap highlights another key point, which is at some point we are going to, the end is endemicity. And at one point, where people choose to remain unvaccinated, they're going to continue to be at risk of severe outcomes, even after all these measures that are in place really to protect them start to disappear. So it's incumbent on people at this point in time to access 2 doses of vaccine if they haven't yet already.
Dr. Lowe, we know that once it was announced that you would need proof of vaccination to attend, let's say, sporting events, concerts, to dine inside of restaurants. We saw people who had previously been reluctant or hesitant going to get vaccinated. Now we know that about January the 17th, proof of vaccination may no longer be required. Do you think those people who are still hesitant or holding out will just wait this out? Will it discourage those who have already been discouraged?
Well, I think really the reality is that everyone should be seeking advice. And I think a lot of individuals in Ontario have been vaccinated already. We all know someone out there who hasn't yet had the chance to take the vaccine yet, and for whatever reason. And so I think it's really incumbent upon all of us to reach out to our family and friends who maybe haven't made that decision yet and help them understand. Ultimately, we are moving to a future where many of these guardrails to protect people, especially those who are unvaccinated, will disappear. And those people, for them, the virus will be as new to them that day as it was in January 2020.
All right, there are so many uncertainties in the days ahead, but at least now we have some kind of an end date. Hopefully the end of the pandemic is actually near.